Hello guys, so last week we talked about Strep A. So this week we're going to be talking about Scarlet Fever, because Scarlet Fever is an infectious disease resulting from Strep A. So don't forget to watch the video all the way through to the end so you don't miss out on any important information, and please hit that subscribe button to make sure that you don't miss out on any of our weekly videos. And if you want to catch that video about Strep A, click that little info card above and then you can watch that video either before or after this one. So what is Scarlet Fever then? Well, Scarlet Fever is a contagious infection that affects mostly young children, and it can easily be treated without antibiotics, and most people make a relatively swift and full recovery. But if you think you or your children or child might have Scarlet Fever, then you should always seek the GP advice and not visit A&E. But recognising the signs of Scarlet Fever is really important. Now, the first sign of Scarlet Fever can be kind of flu-like symptoms. They can include a really high temperature, maybe a really sore throat and swollen neck glands, so large lumps on the side of your neck. A rash that appears 12 to 48 hours later. It also looks like small raised bumps and starts on the chest and the tummy, and then it will spread. And the rash kind of makes your skin feel very rough, a bit like sandpaper would do if you ran your fingers over it. On white skin, the rash will look pink, red or even purpley. It may be harder to see on darker skin, but you can still feel that sandpaper roughness. A white coating can also appear on the tongue, and this peels, leaving the tongue red, swollen and covered in tiny little bumps. You might have heard the term strawberry tongue, because it looks very similar to a strawberry. Now, the rash does not appear on the face, but on white skin the cheeks can appear very red. It might be harder to see on darker skin, but it could still be possible. Now, the symptoms are the same for children and adults, although Scarlet Fever is less common in adults. Now, you should always seek help from your GP if you suspect your child or yourself have Scarlet Fever. Always phone ahead and say you suspect Scarlet Fever, because Scarlet Fever is highly contagious, so you must check with your GP before you go in. They may suggest a phone consultation instead and prescribe antibiotics over the phone, because early treatment of Scarlet Fever with antibiotics is important to reduce the risk of complications such as pneumonia or an invasive infection. Now, if your child has Scarlet Fever, or you do, you must keep them at home or yourself at home until at least 24 hours after the start of the antibiotic treatment to avoid spreading the infection to others. Now, the antibiotics will help you get better a lot quickly, and also they reduce the chance of a serious illness, and it'll make it less likely that you're passing infection on to somebody else. It's really important, if you are prescribed antibiotics, you keep on taking them until you've finished the course of antibiotics, even if you start to feel better, or even if the child starts to feel better. You can also relieve symptoms of Scarlet Fever by drinking lots of cool fluids, eating soft foods if you have a sore throat, taking painkillers like paracetamol to make you feel better or the child feel better, and these will also help bring down a high temperature. But never ever give aspirin to children under 16. You might also consider using chamomile lotion or antihistamine tablets to ease the itching of this rash that they might have. Now, you might think, how long does actually Scarlet Fever last? Well, Scarlet Fever lasts for around about 1 week, but you can spread Scarlet Fever to other people up to 6 days before you even get the symptoms, until 24 hours after you've taken your first dose of antibiotics. And if you do not take antibiotics, you can spread the infection for 2 to 3 weeks after your symptoms have started, which is why it's really highly contagious. So it's really important, if you or your child has Scarlet Fever, you stay away from nurseries, schools or work for 24 hours after you've taken the dose of antibiotics. You might think to yourself, is Scarlet Fever dangerous? Well, Scarlet Fever can be a serious illness. However, most cases will respond quickly to antibiotics, and you or your child will feel unwell but then recover within a week. There is a recent increase in cases here in the UK where I'm based, but this is probably due to children having been less exposed to Strep A and other infections during the lockdown that we've experienced here because of COVID. Scarlet Fever is also a notifiable disease in the UK. This means that health professionals must inform public health if they suspect someone has it. because there can be a few complications from scarlet fever. And they range from ear infections, throat abscesses, sinusitis, pneumonia, meningitis possibly, rheumatic fever, and invasive Strep A or invasive Streptococcal infection that will need hospital treatment and can actually be very serious. So how can you avoid spreading scarlet fever? Well, we said scarlet fever is very infectious and can easily be passed or spread to other people. So to reduce the chance of spreading it, make sure we wash our hands often with soap and water. Make sure we use tissues to trap any germs from coughs or sneezes that we might have. Make sure we put the tissues that we've used in a bin as quickly as possible. What we don't want to do is we do not want to share cutlery with other people, cups, towels, clothes, bedding or baths with anyone who has symptoms of scarlet fever. Because remember, scarlet fever is highly contagious, but it can be easily treatable if you get help as soon as possible. That means antibiotics from your doctor. But remember, call your doctor first and explain your signs and symptoms, because they don't want you going in the surgery with something that's highly contagious. Don't forget to hit that subscribe button so you don't miss out on all our weekly videos. Thanks for listening, guys.